What is the Diabetes Health HbA1c kit? The Diabetes Health HbA1c kit is an HbA1c test for those looking for a convenient and flexible option to understand their risk of developing prediabetes or type 2 diabetes on their own time in the comfort of their home. This convenient test measures your levels of HbA1c, which is an important indicator of diabetes risk level that circulates in the blood. All it takes is a simple finger prick to collect your sample. Your results are provided to you online in a report card style format for easy interpretation. If your HbA1c levels are elevated, it may be a sign that you have prediabetes or type 2 diabetes. LifeLabs is here to support you throughout your health journey. So if this does happen, rest assured, you will receive a personalized virtual follow-up from a healthcare professional and the option to access a provincially covered virtual 12-week lifestyle modification program. Type 2 diabetes is a serious disease, but if detected and treated early, it can be managed through clinical care and healthy lifestyle changes. Why is hemoglobin A1c testing important? 1 in 3 Canadians have diabetes or prediabetes, and many of them are currently undiagnosed. Diabetes is a condition that develops when your blood sugar, glucose, is too high. Your pancreas either isn't making enough insulin, or your body isn't responding to the effects of insulin properly. Getting your HbA1c levels checked to understand your risk of developing prediabetes or type 2 diabetes is important because complications associated with the disease can reduce life expectancy by 5 to 15 years. But with early detection, monitoring, and treatment, you can prevent the progression from prediabetes to type 2 diabetes, avoid permanent damage to vital organs, and improve your overall health. Who is the test for? Prediabetes and type 2 diabetes affects men and women of all ages. It can develop without obvious signs and symptoms, and your chances increase if you have certain risk factors like age, over 40, obesity, high blood pressure, high cholesterol, or a family history of diabetes. This test is not appropriate for pregnant or postpartum women within 2 months of giving birth, or persons with type 1 diabetes. Take the first step to a better understanding of your health and get tested today.